Good morning, everyone.
Good morning.
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 All right, welcome. You are in the right place, at the right time, at a moment in history in which we are going to irrevocably change, elevate, invite, and transform the role of our fathers in the lives of women and children, anchoring on the moment that she knows that she's counting not just one, but two. You are part of a movement to change the way that we do our business, at least here in Milwaukee. So if you did not come to that place today, if you are not expected today to be an agent of change, to improve the lives of our children by welcoming fully and engaging remarkably, structurally, spiritually, soundly, how our fathers must be part from before day one, then you have not come to the right place. There is exit 1, exit 2, exit 3. My name is Magda Peck. I have the privilege of being the founding dean of the Zilber School of Public Health, the first new school in 40 years on this campus, and the first to be fully accredited nationally, full-service School of Public Health in the state of Wisconsin.
Yeah, very good.
We are not here to mess around. We are here to find our collective impact. What could be possible if everyone in this room and those who we represent came together as a force for change? It brings together three things that are essential to the Zilber School of Public Health, to our partnership with the Helen Bader School of Social Welfare and other parts of UWM, and our partnerships around Milwaukee and beyond. We need to have the knowledge base. We need to be in the know. That's the research, the data, the experience. It's what we know. And what we know is never sufficient to make change happen. It's just interesting. We got to combine what we know with what we're going to do. Based upon what we know, hopefully, that would be nice. But even doing based on what we know is necessary but insufficient. When we combine our knowledge and our strategies and practice with the political will necessary to get them to do what they need to do to get on board with us, then we will make change happen. This mini conference is a moment of those three things coming together. It is how we do our business in the Zilber School. We promote the best knowledge. We try to strengthen and invent the best strategies. And together we will mobilize the political will so that this community once again becomes the healthiest city in America as it was no more than 50 years ago. That is the dream. That's where you are. And I welcome you to this place of transformation, this place of action. This is not a think tank. This is a do tank. And you are here to do. In doing so, I want to tell you how important it is at this Zilber School that started in 2009 is inching up to 45 students and 16.5 faculty, with 10 more being hired in the next 6 months, yes? 10 to 15 after that. It's a school on the rise, doubling and tripling our student body. We cannot do this in the School of Public Health alone. It is our strategic partnerships, in particular for today's conference, with the Helen Bader School of Social Welfare, and I want to ask you to join me warmly in welcoming their champion, irrepressible, incredibly visionary dean, Stan Starkevich. I also want to acknowledge that we do our work with centers. And so CABR is an essential center that brings the notion of behavioral health and mental health to our work. And Michael Fendrick has not yet joined us today, I don't think. But he's on his way. And when he comes in that door, we don't make him feel guilty for being late. No. We don't do that. We're going to say he's just in time, right? Just in time management. But in absentia, would you join me in just thanking Michael for his leadership of CABR and the partnership we have with him in the School of Public Health. So let's hear from Michael. Both have been incredible supporters, both Michael and Stan, for the Young Parenthood Study Team, which took a lead in putting this conference together. I also think it's essential for us to acknowledge the Office of Adolescent Health and the Office of Adolescent Pregnancy Programs that have given funding for this. And the money is not always coming these days, so we want to use every penny that we can to make the difference that needs to happen. So what's the deal? The deal for today is to be powerful in our thinking together about the strategic, essential, and absolutely non-negotiable role of fathers, especially during pregnancy. It is a pivotal time, a pivotal window, and we must seize that window together. And I come from a field and trained in another school of public health that happens to be, well, let's say in Boston, and a really old one. And I would just tell you that I grew up in the Department of Maternal and Child Health, and everybody talks about MCH. You know, we even have a song at one of our conferences, YMCH. It's amazing what we do. But where's the F? And how do we bring our letters in alignment that we talk about parenting together? And too long we have put moms over here and dads over here, or dads not in the picture. This is our moment to reclaim the fathers and do it right in terms of what we know, what we do, and what we get others to do. I would bottom line tell you that the goal of this conference, I'll make sure I get it right, is to learn together about what we can do in this community to support positive fatherhood engagement in the context of the health of pregnant women and the well-being of their babies. You're going to work hard today. Hopefully you'll play hard today. And if you don't have a good time, as I always am known to say, it is your own damn fault. So no whining, because there's too much at stake. And I'm here to make sure that you not only come to the Zilber School again. For how many of you is the first time in this building? Put your hands up. Ooh, wander around. Check out the second floor. In particular, wander. Walk the stairwells. And in particularly, come on up to 5 and see our new collaborating commons, which is the coolest spot, I think. Thank you, Jeff. The coolest spot to be able to do follow-up collaboration work together. So this is your public health home. And for those of you on campus, Bill rides the bus back and forth on a regular basis, so we're connected, just one bus ride away. Look around for a sec. Are there 3 people that you don't know? If you can't see, do me a favor, stand up. Come on, stand up. Come on, you can do this. Stand up. A little bit of movement gets the brain wet. Now look around and say, are there 3 people you don't know? Yes. All right, now eyeball those 3 people, because they are your hot dates today. You want it, Valentine's Day, you know, we're just extending it for another 24 hours, right? So you want to do that, be mine forever. If you walk out of the 3 people, you look around and say, I didn't meet at least 3 people today, well then shame on you. Because it's the power of our connectivity to each other that will make this happen overall. I would like you to find one of those people and just do a quick introduction. So go find one person and say hi, and then go ahead and sit down. We're at time. Doesn't that feel good? Because you cannot do this by yourself. And you cannot even do it with the people that you do it with. The only thing that will happen is if we all do it together and we figure out today what the it is, what a couple of the its are that we're going to do first, next, and after that. Because this is a movement, not a conference. Now, the person who I have found has been at a quiet cornerstone of this work for quite some time, and someone who's been a champion in scholarship, a champion in practice, and a champion in influencing policy is Paul Florsheim. And Paul is going to be our navigator over the next couple of hours together. And I will tell you 3 things about Paul and then pass this off to him as we continue along. So here's the technical thing. The technical thing is he was one of the first faculty hired for the Zilber School of Public Health almost 5 years ago. Is that true? More or less, 4, 3, 2. It's been about years, it feels like. But as our founding faculty, he also has served as a critical role, not only as an associate professor in community behavioral health promotion, but he is the chair of our faculty. We have a non-departmentalized faculty. So as we build from 2 to 5 to 8 to 16 to 27 to 40, that's herding cats. And I want to thank Paul for his leadership role with our faculty. He also is an associate professor and a scientist in CABR. So he has been working, first hired actually into the Bader School. So he's been doing the straddling between Bader and Zilber for better than anyone else and for the longest time. And so I want to thank him for being able to be a bridge so that there aren't silos here at UWM, which is what brings academia to its worst. And last, I want to thank him for being a passionate father of 3 amazing men that are growing well. And his passion around bringing fathers in is personal and professional. So I would ask you to join me in thanking him for his leadership and ask him if he will navigate us well. I pass it off to Paul Florsheim.
All right. So that's my boss. Can you imagine having to live up to that level of expectation every day? And I hired her. All right. So I am Paul Florsheim, and I'm the director of the Milwaukee Young Parenthood Study, which is supporting this conference. And I have been invested in fathers and young fathers in particular for a long time. And I'm really glad to welcome you here today. As you've heard from Magda, we're going to spend the day focusing on father engagement during pregnancy and across the transition to parenthood, and I'm very eager to see what happens. It's a really diverse group of people from all different parts of the city and the state. Is that? I don't have that on. Can you not hear me? It's okay? No? Oh. Yeah. Hold on. All right. So I'm going to take is that better? No?
Can you put it a little higher? Put it higher up.
Hello?
Is that better?
Is that better?
Or hold it.
Is that better? That's better. All right. Okay, I'm going to take a few minutes to orient you to the day's events and introduce you to our speakers and moderators and the Young Parenthood staff who've put this together. However, before doing that, I want to provide a little bit of background, and I'm going to try to move quickly through this. So for us, I need to go to the next slide. So what are the goals of this mini conference? For us, the Milwaukee Young Parenthood Study staff, this conference marks an ending. Our current funding is ending this month, so for us, it's sort of a last hurrah. Bringing all of you together to talk about fathers seemed like a good way to end one chapter and perhaps begin another. The conference is also intended to be a token of our appreciation to give something back to the community that supported this project. We're particularly grateful for the folks, or to the folks, at St. Joe's Hospital, Columbia St. Mary's Hospital, the 16th Street Community Health Center, and Aurora Sinai Medical Center. We're grateful for their help recruiting young fathers into our project, but we're also grateful for their commitment to providing the best prenatal care possible for their clients. Their clients are also our clients. What do we hope to give you? We've designed this conference so that by the time you walk out the door, you will have a concrete idea and a fledgling plan for increasing father engagement through prenatal care. For increasing, we realize that many of you in this room may not be directly involved in prenatal care, but it is my assumption that you can still be invested in that effort and work to do something, big or small, to support this endeavor. The goal of this conference is not to teach you what to do, but to help ideas germinate. So we're focusing, I want to start with a few questions. We're focusing on fathers. Why fathers and why prenatal care? We're focusing on fathers because we know that fathers play an important role in child development by being positively engaged. We also know that fathers have an impact on child development if they are negatively engaged or unengaged. So we're focusing on prenatal care because we see it as a window of opportunity for identifying young fathers and for capitalizing on their motivation to make things work out. This is a period of high anxiety for young men and women, but it is also a phase when many young men feel optimistic and are wanting to become good fathers. The question is, how can we harness that optimism? How can we help make that happen? Now, I want to add a caveat here. After years of experience, I have come to believe that there is a small group of children who are better off without their fathers being actively involved. Some fathers are too violent and dangerous. It is important for us to consider what to do about these fathers and their partners and their children, but not today. Today, I want to focus on the large majority of fathers who are good bets for becoming positively engaged. Now, if you'll allow me, I want to spend just another moment discussing an interesting trend in the demographics of parenthood that underscores the need to focus on engaging fathers during the prenatal period. It seems fairly clear that in Milwaukee and many parts around the U.S., the adolescent childbirth rates are going down. This is a public health success story attributed to the success of comprehensive sex ed and the promotion of safe sexual behavior. However, while this downward trend in adolescent childbirth has been occurring, the rates of babies born to unwed parents has been steadily increasing. So these are the rates and the numbers going up. This upward trend in the rate of babies born to unwed parents has led to increases in the percentage of children growing up in single mother households. This shift represents a dramatic difference in how our society is organized. As unwed parenthood increases, and I want to emphasize the word parenthood because it's not just unwed motherhood, there's fathers who are unwed too. The challenge of keeping fathers involved also increases. In the past, marriage has not guaranteed father involvement in child rearing, but it helped a lot. Outside the context of marriage, mothers and fathers need to work harder to stay positively engaged with each other. They might even need a different framework for approaching co-parenting, which we define simply as two parents working together to support their child's development. And it's important for our services to adapt to the realities of unmarried parenting and co-parenting, to support fathers who want to be engaged with their children but are struggling to figure out how to do that. Okay, so now I'm going to outline today's activities, introduce the speakers and moderators who will provide us with different frameworks for understanding and working with fathers. Our first speaker is Dr. Marcy Carlson, who's a professor of sociology at the University of Wisconsin-Madison. She's over there. And I'm going to introduce the speakers and the moderators now, and so as not to sort of interrupt the flow as the morning sessions go. Her interests include father influences on children in unmarried families, and Marcy will present her research on predicting variations in father involvement and how to make sense of those variations. Our second speaker is Connie Dallas, who is an associate professor in the College of Nursing at the University of Illinois, Chicago. Dr. Dallas's research focuses on improving child well-being in African American families by examining personal and contextual factors that promote or inhibit father involvement. Dr. Dallas will be presenting on how fathers experience prenatal care settings. Our third speaker is Dr. Craig Garfield, who is an assistant professor at Northwestern University Feinberg School of Medicine. His research focuses on understanding the role parents play in the health and well-being of children, particularly the role of fathers. Dr. Garfield will present on father engagement in pediatric settings, reminding us that the goal of including fathers in prenatal care is to increase their involvement in the lives and well-being of their children across the lifespan. I'm really happy to have these speakers here today. So thank you. So the day is tightly organized, and we will have only about 5 minutes for questions or comments after each speaker. Time is short, but we do not want to stifle you. So we have devised a plan for continuing the discussion. If you have questions or comments, please write them down on a Post-it note. We've provided you with Post-it notes. And then put your thoughts on the wall in the hallway just outside these doors. These questions and brilliant ideas will help generate discussion later on in the day. If you want to talk with Dr. Carlson, Dr. Dallas, or Dr. Garfield, each will be having lunch in a different room, and will use the lunch hour to answer questions, to have discussion. All right. So after lunch, we will be convening 3 breakout sessions, which will be run in separate rooms at the same time. One is on policy, one is on programs, and one is on cross-system collaboration. You will have the opportunity to attend 2 of the sessions because they'll be run back to back. Hopefully, you know which ones you're signed up for when you registered. But the important thing is the focus question, as Magda indicated, for all 3 sessions is how can we improve father engagement during the prenatal period and transition to parenthood? That is our guiding question for today. So the policy session will be moderated by Dr. David Pate with some assistance from Marcy Carlson. Now, did he make it yet? Is he over there? Let's see him. Yeah, okay. Dr. Pate is an associate professor of social work at UWM. His research focuses on the use of qualitative methods to examine the role of non-custodial fathers on their children and the mothers of their children. He's particularly interested in the effects of policy on those fathers and their families. The program session will be moderated by Dr. Emmanuel Ngui with help from Connie Dallas. Dr. Ngui is an assistant professor of public health at UWM here in the Zilber School of Public Health. His research focuses on health disparities through the lens of maternal and child health. He also has research interests in bioethics and children with special health care needs. Okay. All right. The cross-systems collaboration session will be moderated by Dr. Sherry Johnson along with Craig Garfield. Dr. Johnson is an assistant professor of pediatrics at the Medical College of Wisconsin. She's also my wonderful collaborator on the Milwaukee Young Parenthood Study. Her research focuses on increasing mental health competencies among clinicians and staff in community health care settings. Finally, we will be having a harvesting session, which will be led by Magda Peck. So you got a little taste of that already. She's an incredibly talented woman, and one of her many talents is the distillation of ideas. She will help us wrap things up and leave the building feeling motivated and empowered. As a way of adding to the fun and excitement, we will be giving away fatherhood books to 6 lucky attendees. This is intended to entice you to stay until the end. We want to keep you here because we have constructed this day as a package deal and believe that you will get the most out of it if you stay to the end. So it's very important to me, before we get started in just a moment, and I'm on time, to acknowledge the people and the institutions who've made all of this possible. So the University of Wisconsin Young Parenthood staff, I'd like actually everybody who's involved with the Milwaukee Young Parenthood study to sort of stand up if you're not already standing and sort of wave. This has been, they have worked so hard, not just to do the study, but to get this mini conference organized. So I want to acknowledge their efforts. And I want to point out particularly Megan Howard, who has done an incredible job, and Selena Webb Ebo, who. All right, Selena. I want to thank the Zilber School of Public Health, and particularly Magda Peck. I want to thank all of our community partners, many of whom are here. I want to thank the Center for Applied Behavioral Health Research, particularly Mary Heller and Eric Resnick. I don't know if Eric is here. I want to thank the Medical College of Wisconsin, who Sherry is connected, and they've been very generous with her participation in this. The Helen Bader School of Social Welfare, my original home, and to our funders, the U.S. Department of Health and Human Services, already mentioned by Magda, but I want to particularly thank a couple of people who aren't here, Cassandra Chess, the program officer who's been working with me for a long time, and Alicia Richmond Scott, who was the director of the Office of Adolescent Pregnancy Programs and has been a supporter for many years. So with that, I'm going to turn it over directly to Marcy, to Dr. Carlson.